Hello, everyone. Dr. King here, back again to talk to you a little bit about feeding and eating disorders. So, just one second. All right. So, the feeding and eating disorders we're going to talk about today include Pica, Rumination Disorder, Avoidant Restrictive Food Intake Disorder, Anorexia Nervosa, Bulimia Nervosa, Binge-Eating Disorder. So feeding and eating disorders are characterized by persistent disturbance of eating and eating-related behavior that results in the altered consumption or absorption of food and that significantly impairs physical health or psychosocial functioning. I'm going to talk a little bit about Pica. So Pica is the persistent eating of non-nutritive, non-food substances over a period of at least a month. So the eating of non-nutritive, non-food substances is inappropriate to the developmental level of the individual. So what we mean by this is someone may eat chalk or cotton balls or socks or paint, things that are really strange. And some of this might be caused by something medical, like a loss of not enough minerals or vitamins of a certain sort, and then some of it's psychological. And so this has to go on for at least a month, and it's not part of a culturally supported or socially normative practice. Some places people eat different types of foods that maybe aren't common to other regions of the world, but this is not like that. It's not like something that's eaten in one culture that maybe is not sanctioned in another culture. It's non-nutritive, non-food substances. If the eating behavior occurs in the context of another mental disorder or a medical condition, it's sufficiently severe to warrant additional clinical attention. So it's not just the occasional strange behavior that could be incurred by a hallucination or a delusion as a part of like a intellectual disability or ASD or a psychotic episode. Or if it is a part of that, it's more severe. It's severe enough to warrant a separate diagnosis. And so this does not include the ingestion of diet products that have minimal nutritional content. And the onset of Pica can occur in childhood, adolescence, or adulthood, although childhood onset is most commonly reported. Pica can occur in otherwise normally developing children, whereas in adults it appears more likely to occur in the context of intellectual disability or other mental disorders. So in childhood, children who are developing normally can get this. Like I said before, it could be possibly a symptom of a nutritional deficit, but it can also just be psychologically related. And this can also manifest in pregnancy when specific cravings can occur. So a couple of examples of this. 7 months pregnant Emma Vaness, 26, is inexplicably drawn to eating polish despite her own fears she could be harming her baby. After the first time, she said she was determined not to do it again, but every day her craving comes back with a vengeance, leaving her desperately searching for snacks in the cupboard under the sink. Since her unusual habit started, she's consumed 3 whole cans of varnish and now worries her craving will never go away. So obviously she knows that this is not normal and she's fearful that it will hurt her baby, but she can't stop. Emma from Birmingham was first drawn to the cleaning product a few months into her pregnancy and now says she must eat it 2 or 3 times a day to keep her cravings at bay, and her strange obsession with non-edible items started as a child when she began eating bubbles out of her bath, something she's done ever since. Okay, so that's just an example of Pica disorder. Rumination disorder is the repeated regurgitation of food for at least a period of a month. Regurgitated food may be re-chewed, re-swallowed, or spit out. The repeated regurgitation is not attributable to an associated gastrointestinal or other medical condition. The eating disturbance does not occur exclusively during the course of anorexia nervosa, bulimia nervosa, binge-eating disorder, or avoidant restrictive food intake disorder. So they are regurgitating the food, but it's not to lose weight. And it may be re-chewed, re-swallowed, or spit out, whereas the anorexic might take a bite, regurgitate it, spit it out, because they don't want the calories. If the symptoms occur in the context of another mental disorder, like intellectual disability or another neurodevelopmental disorder, then they are sufficiently severe to warrant additional clinical attention. So it has to be very severe, not just the one-off random occurrence. So avoidant restrictive food intake disorder, this is an eating or feeding disturbance, example, like an apparent lack of interest in eating food or avoidance based on the sensory characteristics of the food. And there's concern about aversive consequences of eating as manifested by a persistent failure to meet appropriate nutritional or energy needs associated with one or more of the following: significant weight loss, significant nutritional deficiency, dependence on enteral feeding or oral nutrition supplements, and marked interference with psychosocial functioning. So they won't eat because they aren't interested in the food, they don't like the sensory characteristics of the food. It's pickiness to the ultimate extreme where it's clinically significant. It's not better explained by lack of available food or an associated culturally sanctioned practice. The eating disturbance does not occur exclusively during the course of anorexia, bulimia, and there's no evidence of a disturbance in the way in which one's body weight or shape is experienced. This is not about weight loss. It's about a sensory aversion to the actual food. And the eating disturbance is not attributable to a concurrent medical condition or not better explained by another mental disorder. When the eating disturbance occurs in the context of another condition or disorder, the severity of the eating disturbance exceeds that routinely associated with the condition or disorder and warrants clinical attention. Anorexia nervosa. So anorexia is the restriction of energy to intake relative to requirements leading to a significantly low body weight in the context of age, sex, developmental trajectory, or physical health. Significantly low weight is defined as a weight that's less than minimally normal, or for children and adolescents, less than that minimally expected. There's an intense fear of gaining weight or becoming fat, or persistent fear persistent behavior that interferes with weight gain, even though at a significantly low weight. There's a disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or persistent lack of recognition of the seriousness of the current low body weight. Some of the subtypes include some individuals with binge eating or purging type of anorexia, and that's those who binge eat and also purge through self-induced vomiting or the misuse of laxatives, diuretics, or enemas. And some individuals of this subtype do not binge eat, but do regularly purge after the consumption of small amounts of food. And there's a crossover between the subtypes over the course of the disorder is not common. Therefore, subtype description should be used to describe current symptoms rather than longitudinal course. So individuals with anorexia nervosa have an intense fear of gaining weight. When they look in the mirror, they see someone who is much larger than they actually are. And the experience is intense fear of gaining weight and wrapping up one's identity with body shape. Bulimia. So bulimia nervosa includes recurrent episodes of binge eating. And an episode of binging is characterized by both of the following: eating in a discrete period of time within a 2-hour period, an amount of food that's definitely larger than most individuals would eat in a similar time under similar circumstances. And there's a sense of a lack of control over eating during the episode. And then afterwards, there's a recurrent inappropriate compensatory behavior in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or other medications, fasting, or excessive exercise. The binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months, and self-evaluation is unduly influenced by body shape and weight, and the disturbance does not occur exclusively during episodes of anorexia nervosa. So you'd want to specify again, people with anorexia can purge, and you would specify the purging subtype for that, but bulimia is different, and it's really characterized by that binge eating and then purging, or excessive exercise, or other behaviors to get rid of the food, like misusing laxatives. And this binging, like impulse control, lack of ability to control it, happens about once a week for 3 months, at least once. You're going to specify if in partial remission. So after full criteria, bulimia nervosa were previously met. Some, but not all, of the criteria have been met for a sustained period of time. In full remission means after full criteria for bulimia nervosa were previously met, none of the criteria have been met for a sustained period of time. You're going to specify the current specificity, mild, moderate, and severe. Mild is 1 to 3 episodes per week. Moderate is 4 to 7 episodes per week of the compensatory behaviors, such as purging. And severe is 8 to 13 episodes of inappropriate compensatory behaviors a week. Extreme is average of 14 or more episodes of inappropriate compensatory behaviors a week. So not all diagnoses in the DSM have an extreme qualifier. This one does. Binge-eating disorder. Moving along. Binge-eating disorder is characterized by recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following: eating in a discrete period of time, example, within any 2-hour period, an amount of food that's larger than what most people would eat in a similar time period under similar circumstances. 2, a sense of lack of control over eating during the episode, example, a feeling that one cannot stop eating or control how much one is eating. The binge eating episodes are associated with 3 or more of the following: eating more rapidly than normal, eating until feeling uncomfortably full, and eating large amounts of food when not physically hungry. Eating alone because of feeling embarrassed by how much one is eating, feeling disgusted with oneself, depressed, or very guilty afterward. There's marked distress regarding binge eating is present, and the binge eating occurs on average at least once a week for 3 months. So once a week for at least 3 months, someone has an episode of eating way, way too much in a 2-hour period, and they feel bad about themselves, or they eat alone, or they're eating more than normal. And the binge eating is not associated with recurrent use of inappropriate compensatory behavior, as in bulimia nervosa, and does not occur exclusively during the course of bulimia or anorexia. So this is very different from bulimia and anorexia. The binge eating disorder is basically like bulimia in the sense that the person loses control and has an episode of binging, but they don't use the compensatory measures to manage it, like purging, to get rid of the food, like purging, excessive exercise, or use of diuretics, or laxatives. So you're going to specify if in partial remission or in full remission, and then you're going to specify the current severity. And we have mild, moderate, severe, and extreme. Mild is 1 to 3 binge episodes per week. Moderate is 4 to 7 binge episodes per week. Severe is 8 to 13 binge eating episodes per week. And extreme is 14 or more binge eating episodes per week. And then we have other specified or feeding or eating disorder. And this applies to presentations in which symptoms are there and they cause clinically significant distress, but they don't meet the full criteria for any of the disorders. Yeah. So some different presentations that could be like the other specified designation include atypical anorexia. So the criteria are met, except that despite significant weight loss, the weight is within or above the normal range. Bulimia Nervosa of low frequency or limited duration. So all the criteria are met, except that the binge eating and inappropriate compensatory behaviors occur less than once a week or for less than 3 months. Binge eating disorder of low frequency, purging disorder. So it could be in the absence of binge eating. So maybe the person is engaging in the inappropriate compensatory behaviors, but they don't meet the criteria for anorexia and they don't meet the criteria of the binging that happens in the bulimia diagnosis. And then there's night eating syndrome, which could be from a sleep-wake disorder. Recurrent episodes of night eating is manifested by eating after awakening from sleep or by excessive food consumption after the evening meal. There's awareness and recall of the eating. The night eating is not better explained by external forces such as changes in the sleep-wake cycle or by social norms. This is not involved in a substance use disorder or another medical disorder. Okay. And that's all I have for you today. What you think of yourself is much more important than what people think of you. So with eating disorders, what we want to remember is that usually the person's view of themselves is very different from the way that they maybe actually look in the mirror. But what is characteristic of many of these things is that the person is engaging in an eating disorder to cover up feelings or to not feel feelings or to try to control a situation in an extreme way in order to manage feelings. So that's something to consider. All right. Hope you have a good day. Thank you so much for listening.